of Nursing and discuss that study. Good morning to you. Let's talk about the significance of that first of all. How important do you think this is?
This is really important research and we welcome it with open arms. The RCN's been campaigning for a long time now, along with other organisations, for the better protection of staff against this infection, which is predominantly airborne.
And in terms of those masks, I mean, David Shupman explained exactly what an FFP3 is and the difference between that and a sort of standard surgical mask. Should everybody really be using those higher grade ones?
What's important to recognise with this research is the risks that are faced by healthcare workers. So when healthcare workers care for patients, it's very different to the general public going about their daily lives. So healthcare workers are in close contact for long periods of time with patients known or suspected to have COVID-19. And that close-up contact is where the greatest risks lie. So for the general public, face coverings, social distancing, and obviously getting vaccinated are really important. But healthcare workers can't manage many of the risks around them where they work.
So needing them is one thing. What about access to them, Rose? Can all those healthcare workers get those FFP3 masks?
So unlike at the beginning of the pandemic, where we had interruptions to the supply chain, what we are told now here in the UK, and we are very lucky, is that supply is not an issue. So at this moment in time, this is about having clear, consistent infection control guidance that allows healthcare professionals to use FFP3 masks when needed in close contact with known or suspected patients with COVID-19, regardless of where they work.
What do you think, Rose, about the future of face mask wearing? Not necessarily just in hospitals for healthcare workers, but more broadly across society, because everyone talks about July the 19th. I've noticed that ministers are being asked now about what they will do after July the 19th. What are your thoughts on that?
Well, as a nurse, what I would say is that it's really important that we are all safe. Wearing face coverings and face masks if you're a healthcare worker can be uncomfortable, and we recognise this. What's really exciting, though, particularly for healthcare workers, is the innovation that's going on. So over the next couple of years, I think we'll see the design, the comfort, etc., of these higher grade masks really changing. And I do feel that the big learning will be that masks are going to be with us for a long time.
Do you think it's entirely a personal decision, of course, do you think you'll continue to wear them, for example, on public transport or in crowded places? So
personally speaking, I will be continuing to wear a face covering in enclosed spaces. This is all about ventilation predominantly. So public transport and other enclosed spaces, I will continue to wear a face covering, yes.
We were doing a programme live at Coventry Hospital last week, and when we went into various different places in the hospital, we were actually given a fresh face mask by the hospital to wear in that area. Do you think that is something that's going to continue as well?
I think so. That's a precaution to make sure that people are well protected. We'll all be familiar with images of people wearing masks under their chins, attached to their wrists or hanging off their ears. That doesn't protect you. So giving people a clean surgical mask is a good way to make sure when they enter hospitals that they're protected in that environment.
Rose, it's really nice to speak to you. Thank you very much. That's Rose Gallagher, who is from the Royal College of Nursing, talking about the difference between a standard surgical face mask, which most of us are wearing, and those FFP3 ones, which are much tighter fitting, but obviously do provide much better protection.
Should we talk about your favourite subject, football? He's been at the forefront of England's